Now?
Yes, now it's okay. Thank you.
Sorry about that. Can you tell us the name of the scientists who resigned and the 3 who removed their names, and if they gave reasons, what their reasoning was for their actions? And secondly, can you point to any new data or new analyses from the report? You mentioned that it's definitive that this was from December of 2019 in China, which suggests to me that you've ruled out the serology and viral evidence from other countries that China has pointed to, with China arguing that it did not begin in China. So that sounds like a definitive analysis. Is that correct? And are there other definitive analyses or data points that advance this?
Thank you, John. Dr. Van Kerkhove, please.
Hi, John. Thanks for the question. So when the report is released, you will see the names of the individuals of members who asked to be removed from the report. We respected their wishes. I just want to say that all 27 members contributed actively through the course of the last 3.5 years, and this is only a recent development, but you will see the names, and we just wanted to thank them and respect their wishes for asking their names to be removed because they didn't agree with the total report. And that's part of how these groups happen. As DG said in his remarks, not everything was agreed, and that's to be expected in science. So we respected those wishes. I'm going to ask Mariki to answer the second part of that question, but I did want to just caveat something in your question about definitive. I think right now, and what you will see in the report and what Mariki has said, is nothing is concrete, nothing is concluded with absolute certainty. And that's part of the problem that we have right now. Certainly on the earliest cases, there's a lot of information that suggests that there was circulation in December. How far back that goes, if it goes into November or even earlier, that's extremely difficult to be able to state. There was one large sero survey that was done in Wuhan with 43,000 blood samples, and the results we were told is that all of the samples came back negative. We've asked for further sero surveys to be done in and around Wuhan with people who are working with animals, certainly animals that are susceptible to SARS-CoV-2. Again, this is an area in which we feel more work can be done. This is also, you remember, in December 2019, that was an active flu season. There are other circulating respiratory pathogens. Some of the earliest case definitions for COVID, you had to have a CT exam. People were very severe. And at the start of any outbreak, certainly at the start of a pandemic, you're going to miss the mild cases. And what we know now in terms of how the virus spreads and how people could have asymptomatic all the way through severe disease and death, you're certainly going to miss some early cases. We did follow up in a number of different countries where there were indications of positive samples in Italy and France and Spain, and there's a number of them. There's a table in the report, and we followed up on each and every one of those. Having said that, if there are labs in countries that have samples, clinical leftover samples or blood samples or serology, it's worthwhile to have a look. But that needs to be done strategically, because what the evidence does tell us is that there was low level of circulation then. So you have to have the right methods to do so, which is why global collaboration is important. But I think Mariki will probably want to add.
Dr. Venter, would you like to add something?
Yeah, sorry. I think Maria covered most. Sorry, I'm frozen. No, sorry. Maria covered most of what I would like to say as well. So although we say no cases circulated earlier, it really means that it did not circulate at a high enough level that we detected it. The serology from Wuhan